In this session, we'll learn about that what is PTSD. So let's begin it. So the PTSD called as post-traumatic stress disorder, which is a mental health condition that caused by an extremely stressful or terrifying event, either to being the part of it or also to witnessing it. Symptoms may include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. Most people who go through the traumatic events may be the hard time adjusting and also the coping from a short time. But with time and by taking good care of themselves, they usually get better. If the symptoms get worse, last for the months or years, or and affect the ability to function daily, and they may have the PTSD. So, what happens in the PTSD? Particularly, the person may develop something, a traumatic event, and it transforms into the PTSD disorder. Okay, so getting treatment after PTSD, symptoms arise that can be very important to ease symptoms and help the functions better. So, what are the symptoms of it? So, post traumatic stress disorder symptoms may start within the first 3 months after the traumatic event happened. So, first, any kind of traumatic event happen, and the person may get anxiety, depression, etc., which is called as PTSD. And also, sometimes symptoms may not appear until years and after the event. These symptoms last more than 1 month and cause major problems in social or work situations, and also how well you get along with others. So, they can also affect your ability to do your visual daily tasks. Generally, PTSD symptoms are grouped into four types called as intrusive memories, avoidance, negative changes in thinking and mood, and also changes in physical and emotional reactions. Symptoms can vary over time or vary from person to person. So, what happens in that intrusive memories? Symptoms of intrusive memories, which includes unwanted, distressing memories of a traumatic event that cause the back over and over again, and also reliving a traumatic event as if it were happening again, so also called flashbacks. So person might be getting the flashbacks more and more after just the event, that okay, this thing happened that time, this thing happened that time, and that person did this to me. So that flashbacks of the rooms of that place will come up. Upsettling the dreams or nightmares about the traumatic event, severe emotional distress or physical reactions to something that reminds you of traumatic event. Second, called as avoidance. Symptoms of avoidance may include that trying not to think or talk about a traumatic event, that something happened and you don't want to talk about it. Okay, it happens with many of the people. Staying away from the places and even from the people that remind you of traumatic event. Negative changes in thinking or mood. So, what are the third symptoms of negative changes? It includes in the thinking, and mood may include. So, negative thoughts about yourself, that okay, I did this. Sometimes the guilt, the feeling of guilt, shame will develop. Other people or the world, ongoing negative emotions of fear, blame, guilt, anger, or shame will develop. Memory problems, including not remembering important aspects of a traumatic event, feeling detached from family and friends, not being interested in activities you once enjoyed. For example, somebody loved to do dance, somebody loved to write, somebody would love to click the pictures of the nature, photography, etc. So person may not get interested in that. So, having a hard time feeling positive emotions, feeling emotionally numb. And also, what are the symptoms of physical and emotional reactions you may got? Also called arousal symptoms may include being easily startled or frightened, always being on guard or for danger, self-destructive behavior, such as drinking too much or driving too fast, trouble in sleeping. Maybe you will slept in the afternoon and in the night you couldn't. Sometimes you have a lot of thoughts, you will get the panic attacks also in terms of before the PTSD. Trouble concentrating, irritability, angry outbursts or aggressive behavior, physical reactions such as sweating, rapid breathing, fast, heartbeat or shaking, etc. For children 6-year-olds or younger, symptoms may include lot of. So in that also, they also got sometimes the condition of PTSD, which is called as reenacting a traumatic event or aspect of a traumatic event through play. Okay, frightening dreams they may get. If the children got from the situation called as the child abuse, sexual abuse, so they have the frightening dreams. Okay, not include in the aspects of traumatic event. So what causes the PTSD? Approximately 61 to 80% of the people experience in traumatic event at some point in their lives. PTSD develops in about the 5 to 10% of this population. It's unclear why people respond differently to trauma, but studies show the people with PTSD have abnormal levels of certain neurotransmitters and hormones. They also experience brain changes, and also in the brain, the neurotransmitters and hormones changes. So in terms of that also, some of the research papers and studies shows that the people with PTSD have normal to low levels of cortisol, which means the stress hormone, and the elevated levels of corticotrophin releasing factor, which is called as CRF, despite the ongoing stress. CRF triggers the release of neuroepinephrine, which leads to an increase in the sympathetic nervous system response. Okay, so this fight and flight response may lead to the increase in other hormones, in other things as well, called as our body palpitations, heart rate, blood pressure, and also awareness and sterile response. In addition, some studies show the altering functioning of other neurotransmitters in the systems called as, including, you can say, gamma aminobutyric acid, which is called as GABA. Okay, second called as glutamate, because they worked in terms of neurotransmitters to doing the neuromuscular functioning the activities, serotonin, brain changes, etc. So what things can be inculcated in terms of yoga therapy of PTSD? I would definitely say in my trauma lecture also that you should go for the things which can be, keep you the calm, bring you the calmness. Like let's suppose the box breathing you can include. In the box breathing, the person may inhale, hold, exhale, hold. This type of things you can include. You can include the butterfly hug, okay, to relieve the stress, to relieve the panic attacks. You can include the mindfulness techniques more and more. Okay, you can include the things which can be safer. You can include the things, for example, which is very simple, like Tadasana, Kati Chakrasan, and also in the lying down position, in which you will not open up too much body parts. And also with the therapist and with the patient, there is a number of repo formation, because in the PTSD what happened, the people will not may develop easily repo formed. So you have to first need to be asked about their things, what they want, because every PTSD case is differ. Maybe this person may want to do physical more, this person may want to do in terms of breathing more, this person may get to more mindfulness techniques. So it's up to you. Okay, and also in terms of PTSD, this is a proper therapy module that you would definitely suggest to those of your patients as well. So this is all about the post-traumatic stress disorder. Thank you so much for joining it. I hope you will like this session.